I'm Dr. Atul Limay. I'm the Director of Cardiology and Structural Heart Services at Fortis Hospital, Mulund, Mumbai. Today I'm going to speak on the topic of not every blockage needs a stent. Now, as we all know that when coronary artery disease is one of the leading causes of morbidity and mortality in this country as well as in the world. Coronary artery disease यानी कि blockages in the arteries that supply the heart are formed because of inflammation, cholesterol buildup, plaque buildup in the arteries that supply the heart. तो 1990s में जब ये टेक्नोलॉजी सबसे पहले इसकी शुरुआत हुई तब सिर्फ बलून एंजियोप्लास्टी यानी बलून करके उन ब्लॉकेजेस को एक्सपैंड किया जाता था। फिर लेट 90s में बेयर मेटल स्टेंट्स एस्टैब्लिश किए गए and then in the early 2000s drug coated stents became the standard of care for treating coronary artery blockages. जैसे जैसे coronary artery disease की treatment has progressed, उसी तरह से over the last 20 years it has become very clear that not every blockage requires a stent. So which blockages do require a stent? So obviously when patients have a heart attack, whether it is a major attack or a minor heart attack, all such patients require either some sort of revascularization, either angioplasty and stenting, या फिर अगर blockages बहुत extensive हो तो फिर bypass surgery की उन patients को ज़रूरत पड़ती है। जो पेशेंट्स ऐसे हैं जिनके ब्लॉकेजेस माइनर हैं, by which I mean less than 50 to 60%, ऐसे blockages generally do not require any angioplasty. These blockages can easily be managed with medicines alone. So the decision as to whether a patient requires angioplasty or not is a decision that has to be taken seriously with all the patient factors into consideration. And just because there is a blockage, it does not mean that it needs a stent. Now, I know that this people work in two extremes. There are one group of people who believe nobody needs angioplasty. This is not the right approach or attitude. And then there is another group of people who believe that all blockages require angioplasty. This is also not correct and is scientifically invalidated. The truth lies somewhere in between. If you have a heart attack, if you have severe blockages in the proximal or major coronary arteries, it is generally considered a good idea to do angioplasty or stent these arteries so that future symptoms can be relieved. All blockages do not require angioplasty. One should have a clear discussion with their cardiologist and pick and choose which blockages and which patients require angioplasty treatment. The other blockages can safely be left alone to aggressive medical therapy, diabetes control, blood pressure control, smoking cessation, and important lifestyle changes. Lifestyle changes remain the cornerstone for all coronary artery disease therapy.